Hi, I'm Dr. Aliabadi. If you struggle with irregular cycles, acne, facial hair, body hair, hair loss, or insulin resistance, you might be dealing with PCOS, or polycystic ovarian syndrome. Having dedicated my life to helping women with PCOS, I understand the challenges in getting an accurate diagnosis and the right care. That's why I created Ovvy. Ovvy is designed to help you take control of your health with clinically proven, validated ingredients in a simple, once-a-day solution. For too long, women with PCOS have had to choose between lifelong prescriptions or complicated supplement regimens. Ovvy offers a better way to help manage your symptoms without the hassle. It's my mission to empower women facing PCOS and other hormonal issues by providing the information and support they need. Reclaim your health once and for all. Go to ovvy.com. That's OVII.com and start today.
Hi, listeners. Mary Alice here with a special bonus episode of SheMD. May is Women's Health Awareness Month, and as a podcast centered on the well-being of women, Dr. A and I are so proud to share a highlight reel from some of our favorite interviews with some of our favorite mamas. If you've listened to the podcast in the last year since we've launched, you know we're on a mission to ensure all women can educate themselves and take action to be their own health advocate. I am forever grateful to the women who have shown up to our microphones each week to share their health journeys and the experts who have imparted their actionable advice. We start most of our episodes with a short invitation for our listeners to learn more about our platform, Ovvy, at OVII.com, which is a resource we're continually expanding and improving to address the symptoms of PCOS, a condition that affects too many women with symptoms often dismissed by doctors, even the most well-meaning. We would love to hear from you in the comments about what you're doing to prioritize and advocate for your health. You can find us across all socials at SheMD Podcast and our website, shemdpodcast.com. Enjoy this bonus episode, and thank you so much for listening to SheMD. I want to start off the whole thing by just saying vagina, vagina, vagina.
Here we go.
Vagina, vagina, vagina.
Story
Vagina, vagina,
of my
vagina.
life.
America has medical wastelands where women can't get care. They can't go to a doctor like Dr. A. So that's why we're here. That's why we started the podcast. Our mission is to change the world for women's health, and it's actually happened.
Very early on, I realized I just wanted to be surrounded with women. And I had two options in medicine. It was either to become a pediatrician or to become an OBGYN. And I love surgery and I love doing procedures. So I started doing OBGYN. People always think there's this magical story about me being an OBGYN, but the truth of it is I wanted to be with women.
Yeah.
And that was always my passion.
The lesson for me is just like how important it is to choose someone who just like knows what they're talking about and has the depth of knowledge in women's health.
Well, I also want to say that that's why we started the podcast.
Yeah.
Because we want to put the power back in women's hands. I think that, you know, Dr. A and I talk a lot about these women are coming into our lives that have the same goal that we do, which is we're going to change the world for women's health. And whether it's mental health, hormone health, spiritual health, we're all on a mission because we're like, screw you.
Yes.
Like we are, we're going to bring love and positivity to the
Give me a high
world.
five.
And honey, I mean it. And I think you're just right there with us.
Let's hold hands and take people to a better place.
If men had to get pregnant and were at risk of having preeclampsia and having a seizure and having a stroke and dying, do you think we wouldn't know about preeclampsia? We would all know everything about it, how to prevent it, how to diagnose it, how to treat it, all of it.
I just kind of keep wondering, like, if men had to stick their penis in a machine that squished it every inch of his life, do you think that they would do that? I literally, like, my boobs were stuck in there. They're pounding on them. I mean, it's just kind of, I mean,
It's not fun. No.
It's not fun, but it's needed.
If endometriosis was a problem that affected men, it would have been resolved. Done, right? But because it's us, you're being dramatic, painful. I've had painful periods. Why are you so dramatic? No. If you have painful periods, endometriosis needs to be ruled out. Don't let doctors, don't let your family members, your parents, your grandparents, your aunt and uncle, don't let anyone dismiss it. If someone dismisses you, go find a specialist who can help you. There's a cure. We can fix these painful periods.
So there's 4 women sitting in this group right here, and 3 of you have had breast cancer. So says it to me right there. There is a cancer vaccine, and it could be available if they had enough funding. This blew me away.
It's not surprising that 3 of us have had breast cancer. There are so many of us out there, and this really could change things for women, and we're hoping it does it sooner rather than later.
Every time I think that, oh gosh, everyone's probably heard this, I realize not everyone has heard this. There's a billion women out there that are in menopause this year.
I think of mental health and resiliency and recovery. I think of psychiatry and the mind as a thumbprint, and we all have a different one. And so you really have to look full picture.
Thank you so much for everything you've done for my patients, because I never get to thank you. I'm always texting you in a panic mode. 10 p.m., people text me, as you know, and I just divert those text messages to Stacy, and you take the best care of them. You're so knowledgeable. You're so caring. You're so loving. You're so good at what you do. Thank you for taking the time to come here and talk to us about this. I mean, we can talk about mental health.
Yeah, we should talk more about mental health. A lot more about that.
A friend of mine's wife just died of colon cancer in her mid-30s and left a child and a husband behind. It's happening younger and younger, and it's really scary. That's what you've had me getting mammograms since
forever.
Since my early 30s, since I started going to you. Yeah,
because you have family history. So, I mean, you have to
be proactive. You have to be proactive.
Be your own
as
health
much
advocate.
as you can.
Yes.
I got to tell you, colonoscopies, I love them. I love
do too.
going under. I just like that, I'm a mother of 5. I'm like, I go to sleep. It's probably the only time I get deep sleep.
The prep is not easy, though. I hate the prep.
Oh, the prep is terrible.
Until I started this podcast, I always say, I tell people you don't understand what I see during the day, because it's really devastating. If you spend a day with me in my office, you understand what I'm talking about. But now I feel like people are getting a glimpse of what really happens in my office.
And then when I went to her, she was telling me all these things about like my testosterone levels and PCOS and all these things that like I was plagued with, but didn't really know what was actually happening to me. And I don't know, she had such a very like, not nonchalant, but she was so chill about things that I was terrified about. And I'd be like, Dr. A, please, like I just
Stop
I'm dying. Like if I had an ingrown hair, I would just be crying on the phone. I'm just like, please, I can't take it. And I've lived my life the wrong way. And I just think about everything. And, I'm a very, I don't know. She is my general practitioner. If I have any ailment in my body, I call her. If I have bronchitis, I call her. If I have, remember when I had those crazy lumps on my lymph nodes and we were like, does she have mono? Like, what's happening?
Sometimes I'm like, I'm a gynecologist, right?
I don't care.
And as I did some of my own research, which I think so many women end up doing, that was when I found out that women weren't required or really allowed in clinical research in the US until 1993, which made my entire life make sense. And I also learned that women are to this day diagnosed on average 4 years later than men across over 770 diseases. And at that moment, I was like, wow, there's actually a massive data gap when it comes to our understanding of the female body.
When I see young patients with PCOS who are overweight, the number one thing to fix is their self-esteem. That's the first thing I aim, because self-confidence and self-esteem is a must in life for women. Without it, you can't function. You can't get to where you want in life. You can't find a good partner. You have to believe yourself. You have to like yourself. You have to love yourself. You have to feel good in your body. and has nothing to do with looks and beauty. It's just the way you feel about yourself.
You described
She was just sad. She was just broken. She was defeated is the word I would use.
Like if I could have walked away from myself, I would.
I sometimes cry with these patients in my office. I had a patient last week. This woman's life has completely changed. All we did is fix her hormones, treat her acne, freeze her eggs, like just basic stuff that, is her right. But women in general get dismissed.
That is such a powerful message. And that's what we're trying to do in this podcast, is to empower women. We want to empower women to be their own health advocate. And you kind of can't be your own health advocate if you're not taking care of yourself in your relationships too. I think that we talk about it all the time. If you're sad or depressed or in an abusive relationship, like you can't take care of your health. We started this podcast to empower women and educate them and inform them and shed light on important issues for women. And for you to use your platform to be here is amazing.
But in my opinion, majority of these patients go through life not knowing that they have endometriosis because they get dismissed. Even now I get patients who are not PCOS and their hemoglobin A1C is borderline. And the doctors are like, well, you're not diabetic yet. What about doing something right now to prevent this patient from becoming diabetic?
Right.
And we have to focus more on preventative care than treating the sickness.
What we're getting to do is really help survivorship patient cancer, both people who've had cancer, people at high risk nationally with insurance covered care. And no longer do people just need to hear, be thankful you're alive and just suffer with the consequences. We're helping them feel better.
And first of all, you're an angel. I'm looking at you, the light's shining on you. I'm like, this woman is like an angel sitting right in front of me. Thank you for doing what you do.
I think that, we live in a world where we have all these polished portrayals of women, and you guys are kind of taking the curtain back and really asking real questions and sharing real stories. And I think that that's what women desperately need. We don't want more, BS. For lack of a better word, we want real stories. And women are going through postpartum or trying to be moms or trying to juggle being moms. We feel alone, and it's not easy. Sometimes it's beautiful, but it's not perfect. And so thank you.
Oh,
That's
what we do, what we do. Thank you, Annabelle.
Yeah.
You are exactly why we do what we do.
Go on SheMD, listen to it before you go to your doctor's appointment. If you're menopausal, listen to the menopause podcast. If you're having fertility issues, listen to that. Arm yourself, make a list. When you show up to that doctor who's dismissing your PCOS, can't figure it out, you sit there and you say, I have PCOS. These are my symptoms. And SheMD told me I need this prescription, I need this prescription, I need my eggs frozen, and I need my blood test check. Be your own health advocate.
Thanks so much for joining us today on SheMD.
If you want to own your own health, a good place to start is by following us on social media at SheMD Podcast and by subscribing to our show on YouTube or wherever you get your podcasts.
For takeaways from today's episode, visit our website, shemdpodcast.com. We'll see you next time on SheMD. This podcast is for educational and entertainment purposes only. It is not intended as a substitute for a physician's medical advice. You should regularly consult your medical provider in matters relating to your own health. Even though we share our honest beliefs on SheMD, some of the products and services we discuss may involve sponsorships or paid advertising.